Yes, oops, I have to hit OK. I just want to say apologize for the technical difficulties this morning. I had to basically restart from scratch and like re-register, and it was really bizarre. So I'm not really sure what happened, but be that as it may, it happened. So let's see if I can find my slides. Oh, where are they? Oh, wow, that is really strange. I'm using this. I'm using share screen, but I don't know why it's not like opening all my windows. Huh. That's really weird. Okay. Why isn't that working?
Are your slides up in the background, Chris?
They are on my main screen.
Huh.
That's why I'm like, that's puzzling because I'm hitting share screen.
Oh,
Oh, now I
you.
see you.
I'm just trying to remember how to. Wow, that's really
And as a reminder, it is 4 o'clock in the morning where Dr. Delos Reyes is.
well. That doesn't really. I'm used to that. It's just what I'm not sure is why it's not sharing. I don't know if I should send it to you and oh, wait a minute. I can hit share here.
Yeah, if it's not working, you can email it to me and I'll share.
Yeah, that's what I was going to say. I don't know why this is not working at all. That's really weird. It could be because I'm on like Zoom Workplace via the web.
Oh,
That could I've never done that before either, and so who knows?
Yeah, we just upgraded to Zoom Workplace, and there's
Yeah, and I think there's
nuances
yeah.
here.
something
Some
really
glitches with that still.
strange going on. All right, Kara, I'm sending it now. Just to
Okay.
the K Bloom at if I can get it in here. Yep, there you are. Should be in there.
And while we're waiting for
There
this,
it
I
is.
just want to throw an example out to people. I did a M4 elective class a few months ago, and I decided when it started, and there was only 10 students, I asked, how many of you, because you're from a different generation, have been to an opiate death related funeral in the last 5 years? And of those 10 in that class, seven of them raised their hand.
Oh my gosh.
So we have emerging professionals that are growing up. We think about growing up in COVID or growing up in a digital environment. We have people that have lost a lot of friends and family members to early death related to opiate use. So it's something that we all might want to get a better handle on. And if you're a teacher or you work with residents or some younger population, ask the question, you know, how many friends have you lost to this? And you might be pretty jarred. So do we have the PowerPoint?
Did it come through, Kara?
Not yet.
Oh my gosh.
Do you have the iEcho up? Could you upload them to iEcho maybe, and then I can open them?
I don't think I have that open right now.
Okay.
We get there eventually.
Yeah, we
Yeah,
will.
I'm just refreshing.
Just let me know. Yeah.
To piggyback on that, I have a lot of patients who know somebody who have died, one of their family members, one of their friends. So, and that causes trauma around them. And just, I don't know, just spreads all the pain.
For that older generation in my family medicine practice, I have a lot of older women, and they've often lost a grandchild or someone in the family, and sometimes they actually end up providing childcare because one, opioid related death, and two, opioid related incarcerations of young adults who are parents.
Yes, and I worry that this is going to become, and one of our local police chiefs mentioned this. He said 10 years ago, these overdoses were front page news. But now they're to the point where you don't even see them. It's just something that's become part of our culture. And let's hope that we don't take our eyes off the ball here.
I think you say the epidemic has become endemic, and things that are endemic are also damaging and prevalent, but they're not so newsworthy because they're not such a large change that you're seeing. It's something chronic in the background.
And not trying to be political, but I'm finding it harder and harder to do, even in a lot of the political debate. Most of what I'm hearing is we need to put more money in interdiction. But I'm not hearing a lot of discussion from our emerging leaders or our potential leaders about putting more funding into treatment resources or prevention resources, in as much as that's that criminal justice model.
Actually, I just got back from the Council of State Governments yesterday, and that was the discussion was SBIRT and more treatment for adolescents and youth. That was the whole theme of the 2 days. However, those are state officials, not federal officials.
But it's
And
nice
Ohio
to know
wasn't
that
there.
conversation is getting traction amongst leaders. So
It is. And the other part of that was actually how to lock up your guns if your kid is suicidal was also like a half day. I don't have a better way to summarize that, because the discussion won't be get them out of the house. It's here are all the ways to lock them up.
Yeah, and that's probably a discussion for another day. So much to unbundle there. But we're really proud of you for being able to rub elbows with all the leaders at the Council for State Governments.
Thank you. Hopefully that will mean future funding for this and other echoes. So my 20, and actually I got really lucky. My 20 minutes became 45 because the justice presentation person did not show. So
Way to steal their time, buddy.
yeah, so the other primary care provider who is a psychologist, or the other PhD faculty member in a family medicine department is a PhD psychologist, and he talked about all of the different opportunities to intervene with youth in different environments and settings. So I went first and talked about the echo, and then he talked about multiple intervention points. So I'm glad that we both got a little extra time.
Stacey, what was the most practical thing you heard for this group that sees patients, clients, or parents of kids that might be involved?
The most practical. Okay, a lot of them were actually Utah. Their state legislator who sponsored the most youth intervention bills, he gave us a whole list of stuff that he did incrementally over the last several years. When I get that PowerPoint, I can share it with the group. But and I can't even tell you. I mean, there were probably I think he's sponsored like over 60 pieces of legislation related to this topic.
Can you guys hear me okay?
Yes, we can hear you, Chris.
Can you let me share? I tried doing it not from a browser, and I'm going to hopefully be able to share it this way. Okay. I don't know why you haven't gotten the email yet, but okay. Can I share now? Let's see.
Let's try.
It's American.
I have the slides now, so if it doesn't work.
No, I just got, I was gonna say.
There,
now you should be able to see the slides.
I do see them.
Yay. Oh my God.
That perfect.
Literally took forever.
Very fancy graphics, worth the wait.
Yeah, I don't know. We'll see. Well, let me just tell you, I started to do research on this topic about a month ago, and it was very overwhelming. And I really just had to just pick and choose. And so what I decided to do was to tell you a dozen things to know from the last 5 years. So that's basically the way that I constructed this talk. And the learning objectives, I divided those 12 topics into 5 buckets. So I'm going to talk about 2 updated ways of accessing naloxone for overdose prevention. I'm going to review 4 new naloxone formulations that have been FDA approved. I'm going to talk about 1 Ohio law that expands naloxone access. I'm going to summarize 3 recent Ohio reports related to overdose deaths and overdose prevention. And then in my travels, I learned about 2 new awareness campaigns that were specifically targeted at fentanyl. And so without further ado, let's get going. So what I found out is that in 2019, the Akron-Canton Airport became the first airport in the country to install kits containing Narcan. These are the so-called Nalox boxes. So the airport partnered with the City of Greene Drug Task Force to install 7 Nalox box units, and at that time, each one of them cost $250. They trained the airport staff to respond to overdoses and how to use the kits. And the Nalox box units also come equipped with instructions for use by the general public. So this is me on one of my many trips back and forth from Ohio to Las Vegas. And I took my own picture that you can see here with the little green arrow. And there I was minding my own business in the Canton-Akron Airport, in the Akron-Canton Airport, which I actually never used, except that there was a bad snowstorm and there was only one way out, and that was by using Breeze Airlines, which I think one of the few places it flies out of is Canton-Akron. So there I am minding my own business at the airport. And lo and behold, I see this Narcan kit, and I was just so excited that I took a picture of it. So it had been there, apparently sitting there for 3 years, but I hadn't run into it until December of 2022. So that actually happened. So I was just amazed to see that. Even more interestingly, there's lots of Nalox boxes around anymore. And if you go onto the Ohio Project On dashboard, there's actually a big map of Ohio, and you can select the emergency Nalox box cabinet, and it'll show you with the red dots and, you know, with all the list in red, all the places that there are Nalox boxes now. And in fact, I think it's being continuously updated. So, you know, there may be others located that have not been registered yet. So where do you get these things? You can actually go to naloxbox.org, which is a 501c3 nonprofit organization based in Providence, Rhode Island. The boxes now, you know, like I said, when Akron-Canton did their thing back in 2019, the boxes were $250. They now cost between $260 and $325. And sadly, they do not contain any medication. So you also have to purchase the naloxone to stick into the Nalox box, from what I understand. And then you can register each individual Nalox box, and there is a national map website, which is under construction, but at least in the state of Ohio, you can sort of figure out where they are. They also have what's called a Nalox box usage form online. So they're trying to encourage people that if they have to break open one of these boxes, you know, in a public place, that they then go back to the website and, you know, put in the details about, you know, when it was used and things like that. So just some very interesting things there. So the second method of accessing things is the vending machine. This happened in 2022. At least the news story that I read was that Cuyahoga County had a partnership to install 5 naloxone vending machines, and you can see the 5 locations listed there. 3 of them are at the centers for it used to be called the Centers for Family and Children. Now it's called the centers. One of them is at Murtis Taylor, and one of them is on Metro Health main campus. According to the news story, the machine's contents are free, and I think you have to get a code from, you know, wherever the box is located. You get it from a staff person, punch the number on the box, and then you can get whatever product you want. 4 out of the 5 machines, I don't know which one is excluded. It's an interesting conversation, but 4 out of the 5 machines are going to carry other items such as safe sex kits, wound care products, and sharps containers. And then one of them is only going to contain naloxone, from, again, what I understand. And once again, if you go to the Ohio Project On dashboard, instead of selecting Nalox box, you can select naloxone vending machine. And you can see there's a lot fewer of these green dots across the state. But one thing I already noticed is if you look on Cuyahoga County, there's only one dot, and there technically should be 5 dots. So again, it hasn't maybe perhaps kept up in real time. So now I'm going to shift into talking about the 4 medications that have come out in the last 5 years. These are all forms of naloxone, but I just thought it's interesting to discuss them. So the first one I want to talk about is called Cloxado. I will point out that every new drug that comes out contains a V, an X, a Z, or a Q. I don't know why. I think it's because they're very unusual letters and they want to try to make up these weird words, right? So Cloxado, it's got 2 X's in it. This was FDA approved in April of 2021. This is a nasal spray. It's manufactured by Hikma Pharmaceuticals. The rationale behind having double the dose, so your usual Narcan nasal spray has 4 milligrams, this one has 8 milligrams. The rationale is that almost 80% of opioid overdose reversals use at least 8 milligrams of naloxone. And because fentanyl has kind of swept Ohio and swept the nation, there's a thought out there in the scientific community that the fentanyl overdose may require higher doses of naloxone versus heroin. This has become so common that there's actually now a scientific term for it that can be studied. It's called the MNA, the multiple naloxone administration. So they are now actually studying this around the country. So the package that contains 2 doses, so 2 of these little nasal spray things, it costs around $140 retail. The second medication is called Zimhi or Zimhi. I'm actually not sure how to pronounce these. And this is manufactured by the Adamas Pharmaceuticals Corporation. This is an injectable. So it's similar to an EpiPen. So you actually would click the little blue thing on the top and stick it into somebody's thigh, the anterior thigh, and you can actually stick it through their clothing, if that is the best you can do there. And again, the rationale is the same. This actually has a much higher dose than other forms of injectable naloxone. So this is 5 milligrams per 0.5 mLs. And many of you that are familiar with the other form of injectable naltrexone or naloxone, know that it's 0.4 milligrams per 0.4 ml, I believe it is. Again, the price is about $140. It's about the same as the Cloxado, and it comes as 2 per pack. The third one came out last summer. It was FDA approved in July of 2023, and this is touted as the over-the-counter nasal spray because the other big thing that happened was that in 2023, naloxone finally kind of got recognized as that it's okay to be used as an over-the-counter drug. So that was something that was many years in the making. This is an interesting company called Harm Reduction Therapeutics. I had never heard of a drug company that was a 501c3 corporation, but in doing some more research, what I learned is that when they had to put Purdue Pharma through bankruptcy, they took some of Purdue Pharma's money and they created this 501c3 called Harm Reduction Therapeutics. So talk about trying to turn bad money into good. I was kind of amazed. So this one is trying to hit sort of at the cost price point because the package that contains 2 3 milligram doses. So again, it's different because it's got a different dose. So 2 3 milligram doses cost $36. The fourth one just got approved a few months ago in April of 2024. It's a nasal spray put out by Summit Biosciences Incorporated, and it's called Rosenapy, I think. I don't know how to pronounce it again, but there again is that letter Z. You know, it's either the letter Z or the letter X or the letter Q. You'll notice that. And this one is a sort of mega dose. It's nasal spray, but it's 10 milligrams per 0.1 ml. So now you've heard of the 8 milligrams, the 10 milligrams, the 3 milligrams. So I think you can kind of see where this conversation is going. So it's got higher strength per dose versus the other naloxone products. If needed, one additional spray can be given into the opposite nostril if the first one is unsuccessful, but no more than 2 doses should be given in any 24-hour period. So that's a little bit different than what I've read about the other ones. And at least, as of yesterday, there was no details that I could find on cost, distribution, or launch date for this medication. It hasn't been announced yet. So, as we talk about drugs and talk about pharmaceutical companies, you're going to get some criticism. And I just like to point out the criticism, just to point out both sides of the coin here. And so there are some critics out there of the higher dose naloxone. And what they're warning about is unintended consequences. And one of the unintended consequences of using a dose of naloxone that's too high is that you can actually get severe precipitated withdrawal. Perhaps not as severe as, the scene in Pulp Fiction, but still pretty bad, right? And so that's one of the criticisms. I think the other big criticism is that other strategies to make naloxone more available have been overlooked. And I was really taken by this quote, so I'll directly quote Eliza Wheeler, who's a co-director at a nonprofit called Remedy Alliance. And what she said is, we've been asking for the removal of the prescription status of naloxone for 15 to 20 years. We've been asking for cheaper product. We've been asking for easier access. We've been asking for prioritization of harm reduction programs. And then what the FDA, deliver is a 5 milligram injectable naloxone that no one asked for. So I just put it out there for sake of conversation and just getting you to think critically about all these new drugs that you see, quote unquote, flooding the market in the last 4 years. Also did want to show you that Project Dawn has been able to negotiate lower prices. I believe they work directly with the drug companies. So you can see that with the Project Dawn, these are the naloxone costs as of February of 2023. So what they have is the generic naloxone spray. They've got the Narcan 4 milligram spray. They've got the Kloxxado 8 milligram nasal spray. And then they've got the Zimi 5 milligram per 0.5 ml injectable into the leg. And then you can see the prices of, you can just look at the top number in each box here. So $36.60 versus $45.57 versus $57.56, and then again $57.56. So they're able to bring that cost down from $140 retail by doing this deal, I guess. So I just found that interesting as well, is that as you have states that are getting federal grants to run these programs, it seems like they're able to work with the drug companies to perhaps get a cost that is lower. So then programs around the states that are trying to buy these kits can actually get them at a better price, a little bit of a discount, or a lot of bit of a discount. Okay, I'm moving on to the laws. So one law that I wanted to point out is called House Bill 341. Now, House Bill 341 has all kinds of things in it, and this was signed into law in September of 2020, but it does include several provisions that are important to the opiate epidemic and overdose prevention. So the first thing it did is that it removed the requirement that a facility that has naloxone, both for giving it to people and or for administering it on their property, it removed the requirement that you had to have a TDDD, which is a Terminal Distributor of Dangerous Drugs license. So that's one thing that was very important, and I'll explain in a minute why. It also expanded the number of licensed healthcare providers who can authorize a Project Dawn or a overdose, education and naloxone distribution program, who can authorize that protocol, and to include NPs and PAs. The prior language only allowed physicians to do so. And then it also allowed for naloxone to be made available in public locations, so long as it is tied to an existing TDDD license. And then it added some civil liability protections for laypersons administering naloxone. And I took that to mean that it kind of expanded the existing Good Samaritan laws that we already had. So we have Good Samaritan laws. I think those have been around since like 2016. And then, in 2020, they, excuse me, that should say 2020, it says 2000. In 2020, when Governor DeWine signed the bill, it expanded that. And this bill, among others, paved the way to bring naloxone into schools. And so I found this Ohio Department of Health policy brief called Naloxone in Schools. Again, that's my mistake. It should say 2020. I'm sorry. And because of these changes in the laws, that's why you now see a lot more high schools, colleges, universities, that kind of thing, starting to bring the naloxones into the schools. Again, for me, a totally fascinating topic, since both of my daughters are going to be teachers, and since one of them is in college right now. So, all right, I'm going to move on to some of the reports, and there are so many reports online. I picked on 3 reports that I found interesting. This is the BCI lab report. So in May of 2024, the Bureau of Criminal Investigation, they had lab data that was released by the AG's office. That's David Yost. And basically they were looking at the number of fentanyl, specifically fentanyl-related deaths in Ohio. And that was 3,579 deaths. And that represented 98% of the 3,651 overall opioid fatalities just in Ohio in 2023. It's really easy and really scary math, but that equals 10 deaths per day. The other thing I found interesting from the report is that the BCI has identified at least 33 distinct versions of chemically modified fentanyl. So there's fentanyl, there's a fentanyl molecule, and then different chemists and different dealers are sort of chemically modifying that to the point where, at least in the state of Ohio, they've identified at least 33 different kind of relatives of fentanyl that are out there on the streets of Ohio. The second report that I want to share with you is obviously the Project Dawn report. And so the data has been collected on a monthly basis since 2019, and the 2023 data is now available. This is just the overall data. I wanted to tell you that the data is also broken down by specific county, so the 88 counties in Ohio, and as well as by each quarter. And so what you can see here circled in green is that there were 291,722 naloxone kits that were distributed or placed around the state of Ohio. Last year, there were 132,312 people that were trained, and the number of known overdose reversals, and again, there are many overdose reversals that are unknown because they're never reported, but the number of known overdose reversals was 20,368. So to me, that's a very important number, because just imagine what would have happened to the mortality rate had we not had, these known overdose reversals. So again, just things to contemplate as you are, putting all these numbers together in your heads this morning. And then finally, I wanted to talk to you about the EMS incidence reporting system. And you can see that the date of this chart is a summary brief as of this week, September 16, 2024. There's a lot of things that seem very strange when you first look at this chart. So for example, you see that, 2023, it's 32,000 something. And then in 2024, and here we are in, almost October of this year, and the numbers are only 16,932. So that was kind of bugging me at first when I was looking at it. What I realized as I was continuing to sort of study the graph and study the report on the EMS website is that so far for 2024, we've only got 73% of the EMS agencies that have reported in. And then in 2023, we have 85% of the known EMS agencies that have reported in. So what they say in the fine print is that the data from 2022, 2023, and 2024 are all considered preliminary because they have to wait until as much of a high enough percentage of people turn in their data. And the data represent the total number of naloxone administrations recorded by EMS staff. They do not represent the total number of administrations provided in the entire state, strictly just looking at EMS, just to be very clear. Their data is also very fascinating because when you go on their website, it's also broken down by county, but not only that, it's broken down by zip code. So you can get super specific about where EMS is around the state of Ohio, in what neighborhoods they're in, et cetera, things like that. So just a really quite interesting report. So it'll be interesting to see what this report looks like in another 6 months when a bigger percentage of the data is actually in. And then finally, I wanted to end by talking about 2 fentanyl-specific awareness and advocacy campaigns. The first one is May 7th, and this has been around for 3 years now. So it started in 2021, and it partners with another agency called Song for Charlie. And its major thing is to raise awareness about fentanyls, because apparently, Charlie's parents, stated that he died of a fentanyl overdose. I think he took one pill that he thought was Percocet, but it wasn't, and he died after taking one pill. Um, and so then they started this whole movement, which is often how these organizations get started. And so there is a 4-minute video that they're asking everybody to watch, and it's called Fentanyls You Need to Know. I had never heard of the term fentanyl, but fentanyl, I guess, is the name of the fake pressed pills, whether they're selling them as Xanax or they're selling them as ecstasy or they're selling them as oxycodone or Percocet, but it's actually pressed fentanyl. So they're calling them fentanyls. So this is a 4-minute video that's on their website, and then they have sort of all kinds of campaigns and things that you can do. And then the second thing I discovered, I was like, wow, okay, so we've got this one thing on fentanyl. And then I was looking around some more, and I was like, oh my gosh, there's another one. So August 21st is called National Fentanyl Prevention and Awareness Day, right? So it sounds to me almost identical. And I've been trying to sort of figure out what is the difference. Again, one of the things that gets kind of overwhelming very fast when you're looking into all these organizations, it's like there's like hundreds and hundreds of these organizations all around the country and probably all around the world. And then you just kind of wonder, how are they coordinating with each other? Are they talking to each other? How are their campaigns coordinated? The information that they're using, et cetera. So to me, that whole thing is just kind of fascinating. This began only 2 years ago, and it is, I took this directly from their website. It's established in remembrance of those lost to illicit fentanyl poisoning and to acknowledge the devastation this drug has brought to hundreds of thousands of affected members, family members, and friends. The one thing that I found that was quite distinctive about this organization is that they made a big deal about poisoning versus overdose, which I was like, oh, how interesting. What they claim, or again, I pulled the quote directly off their site, is that there is a stigma surrounding the term overdose, where an overdose suggests that an excessive amount of something has been used. And they want the public to understand that there is no safe dose of illicit fentanyl. And for those reasons and more, we move forward with the term poisoning on this site. And many of you on this call are already familiar with and aware that August 31st is International Overdose Awareness Day. And that's been around for probably, 15 years. It's been around quite some time. And so on their website, when they were explaining, well, why did we pick August 21st? And they were saying they didn't want to step on the toes of August 31st, but they thought that it was a very appropriate time to bring up the distinction between overdose and poisoning. So again, just a lot of sort of interesting political, use of words, I guess I would say, and just how that sort of gets portrayed in the media and things like that. So just a lot of very interesting food for thought type of things that I wanted to share with you. So to summarize, here's my summary slide. Here's the 12 things that I thought were interesting that have happened in the last 5 years. The Nalox boxes, the vending machines. I love to say these words: Cloxato, Zimi, Revive, and Rosenapy. Those are the new meds, the new kids on the block. It's actually not anything new. It's all naloxone. The House Bill 341, which is from 2020, not the year 2000. I'll have to change that. The data slides I shared with you from BCI, Project Dawn, EMS. And again, there are hundreds and hundreds of other data points from the CDC and everything, but I just picked 3 that were in Ohio. And then finally, the 2 advocacy days that I discovered from May 7th and August 21st, both specifically aimed at fentanyl. I've also taken the trouble to give you in these 5 buckets the exact websites and things that I consulted in putting this together for you so that you can dive deep into the rabbit hole along with me if you so choose. And I wanted to also announce that I have made a transition and a shift. I am no longer employed at the Ohio Professionals Health Program, and so I'm going to be basically spending my time and my talent and my energy focusing on my nonprofit, which is called Club Hope. The Hope stands for Healing Opportunities Possible for Everyone. I started it in 2018. I was able to get nonprofit status in 2022. My services going forward are going to be coaching, community building, consulting, and training. You can feel free to use Dr. Chris at clubhopeunlimited.com from here on out. And that's my website. And my why and why I started this is that so that no one has to face addiction alone or afraid. And so thank you very much for your attention. I really do apologize for all the snafus earlier today, but we did get it working. So thank you for your patience with me. All right. Go back to gallery view so we can all see each